We're going to talk about developmental, congenital, and childhood diseases and disorders. Now, this is a long chapter, so I'm going to go ahead and break it up into 3 parts. Okay, so the first part we're going to talk about prematurity, genetic syndromes and conditions, diseases of the nervous system, and congenital cardiac defects. So let's get started. All right, so this is what we're going to talk about in the prematurity. Now, the first one is infant respiratory distress syndrome. This is very uncommon in full-term infants that go to 40 weeks. This is also known as hyaline membrane disease. It's acute hypoxemia due to infiltrates within the alveoli. Okay, so there's something in the alveoli and it's causing hypoxemia or low oxygen. The baby doesn't develop surfactant, which is a slippery, protective substance that helps lungs inflate with air and keeps them from collapsing. Surfactant is present in mature lungs. Surfactant coats the inside of the lungs. It keeps them open so an infant can breathe in air once he or she is born. Without surfactant, the lungs collapse and the infant has to work hard to breathe. Bronchopulmonary dysplasia. This is a serious chronic lung disease which results after an insult to the neonate's lungs. It may be due to infant respiratory distress syndrome or extreme prematurity. The lungs are stiff, obstructed, and hard to ventilate. Infants received high levels of oxygen for a long period of time, usually when this happens. There's a physiologic definition also that I found. This is bronchopulmonary dysplasia at 35 to 37 weeks gestation. Infants treated with mechanical ventilator, a CPAP, which is a continuous positive air pressure, or supplemental oxygen concentration of 30% and oxygen saturation of 90 to 96% were diagnosed with BPD. So that was interesting. Okay, this next one is retinopathy of prematurity. It's also known as retrolental fibroplasia. Okay, so retrolental is in back of the lens. This is an abnormal growth of blood vessels in the retinas of premature infants' eyes. The more premature and the lower the birth weight of the infant, the greater the risk of developing ROP or retinopathy of prematurely. Okay? Blood vessels of the retina begin to develop 3 months after conception and complete their development at 40 weeks gestation. ROP occurs when abnormal blood vessels grow and spread throughout the retina, the tissue that lines the back of the eye. These abnormal blood vessels are fragile and can leak, scarring the retina and pulling it out of position. This causes a retinal detachment, which is the main cause of visual impairment and blindness in ROP. An interesting fact, and in the 1940s and early 1950s, they used to give these babies real high levels of oxygen in the incubators, and this caused a lot of blindness due to ROP. After a normal birth, the retinal vessels fill the anterior periphery of the retina. Okay. In ROP, retinal blood vessels fail to reach the retinal periphery and multiply abnormally where they end. Okay. So this is zone 1 right in here. Okay. This contains the optic nerve and the macula. And in zone 2, which is right here, okay, this is an intermediate zone where the blood vessels stop in ROP. So they're going to stop like right around there. And 3, it's right in here, is the peripheral zone of the retina where vessels are absent in ROP but present in normal eyes. Necrotizing enterocolitis. This is an acute inflammatory process caused by ischemic necrosis of the mucosal lining of the small intestine, large intestine, or both. It's caused by normal intestinal flora that invade the immature GI system. Breastfed infants are at a lower risk. It affects 10% of infants less than 1,500 grams. Infection and inflammation that causes destruction of the bowel are part of the bowel. Preemies have immature bowels which are sensitive to changes in blood flow and prone to infection. At high risk are premature infants that have difficult deliveries with lowered oxygen levels. When there is not enough oxygen, the body sends available oxygen to the blood and vital organs instead of the GI tract, thus resulting in NEC, or necrotizing enterocolitis. And the next group we're going to talk about are genetic syndromes and conditions. First one is Robinow. This is a genetic syndrome. It's a skeletal development disorder. It's a condition of small stature and related incidence of interorbital distance. That means their eyes are far apart. Bulging forehead, depressed nasal bridge, misaligned teeth, and short limbs. Hypertrophic cardiomyopathy. This is a congenital disorder that occurs when a portion of the heart muscle thickens without any apparent cause. The normal alignment of the myocardial cells is disrupted, resulting in disruption of cardiac electrical impulses. It's an autosomal dominant trait. Okay, you can see how this left ventricular wall, so this is a normal wall and a normal septum, and so you see how much bigger they are. So when you have hypertrophy, it means you have the same amount of cells, but it's getting bigger. They're getting bigger. And hyperplasia, the organ enlarges because they have more cells, if that makes any sense. I just thought this little girl was the cutest thing. This is, let's talk about Down syndrome. This is a genetic syndrome. The individual has 47 chromosomes instead of the usual 46, and they have an extra chromosome 21, so 3 instead of the normal 2. It has mild to severe mental retardation. They have characteristic facial features and distinctive physical abnormalities. Actually, maternal age is an important risk factor in this. 30-year-old has a 1 in 1,000 chance, and a 40-year-old has a 9 in 1,000 chance. Okay, so Down syndrome. They talk about them having a simian crease. This is a single palmar crease as opposed to 2 in normal individuals. Okay. And it's also called trisomy 21 or Down syndrome, and you see they have three chromosome 21s. Okay, and this is a female because it's got, I'm sorry, it's a male because it's XY. Then we're going to talk about the diseases of the nervous system. First one is cerebral palsy. This is a condition that affects the way the brain controls the muscles of the body. Okay. Now, there are 3 types. You have spastic CP. This is when you have hyperactive reflexes or rapid muscle contractions, and they have that scissor gait. Okay, this is the most common. Now, in spastic CP, the stress on the body created by spasticity can result in associated conditions such as hip location, scoliosis, and limb deformities. Of particular concern is a contracture, the constant contracting of muscles that results in painful joint deformities. Okay. Now, the spastic CP occurs in the pyramidal tract, and it's upper motor neuron damage. The pyramidal tracts pass through the pyramids of the medulla. There are aggregates of upper motor neuron nerve fibers that travel from the cerebral cortex and terminate in either the brainstem or spinal cord and are involved in control of motor functions in the body. Um, Later on, we're going to talk about extrapyramidal side effects when we talk about schizophrenics, but basically, the pyramidal tracts are involved in control of muscle functions in the body. Okay, the other two are ethetoid CP, and this is involuntary muscle movements, especially during times of stress, and reduced muscle tone. They have dysphagia, which is they have trouble swallowing. Ataxic CP, lack of control over voluntary movements, poor balance, and wide gait. So they classify cerebral palsy in many different ways. So some of them say spastic, and the other two are non-spastic. Okay, and so the non-spastics are outside the pyramidal tract. They have mental impairment, or their mental impairment and seizures are less likely. Okay, so people with cerebral palsy cannot fully control motor function, such as walking, and may also have impairment of speech, balance, sight, hearing, or cognition. And cognition is your thinking. We have muscular dystrophy. This is, or MD. This is progressive degeneration and weakening of the skeletal muscles. These weaknesses lead to difficulty in rising from the floor, climbing stairs, maintaining balance, and raising their arms. Results in a characteristic waddling gait and toe walking. These weaknesses lead to difficulty in rising from the floor. Oh, I said that. I'm sorry. And they often develop cardiomyopathy, which is heart muscle weakness, and respiratory problems, because remember, the diaphragm is a muscle. Muscular dystrophy is caused by the absence of dystrophin. Dystrophin acts as the glue that holds the muscles together by maintaining the structure of muscle cells. It is believed to carry signals between the inside and outside of muscle fibers. It is involved in making contacts between muscle cells and the surrounding extracellular matrix. Okay. And there's a specific type of muscular dystrophy called Duchenne's muscular dystrophy, and that's X-linked recessive. Okay, spina bifida. This is an incomplete closure of bones encasing the spinal column. A group of malformations of the spine in which the posterior portion of the vertebrae containing the spinal cord is completely or partially absent. Okay, and you see there's three types. So this is the normal spine, and the first one is spina bifida occulta, opening in one or more of the vertebrae without apparent damage to the spinal cord. Okay, so there's your opening, but no spinal cord damage. There's the opening. Oh well, the arrow's going the wrong way, but that's okay, you get the idea. And as they go down or they go to the right, the condition gets worse. And about 40% of the patients have spina bifida occulta. The meningeocele is a protrusion of the meninges, so the spinal cord is intact. So there's that spinal cord, the yellow, so it's just the meninges that are protruding out. And the myelomeningeocele is a protrusion of a portion of the spinal cord and the meninges through a defect in the spinal column. So you can see that both the yellow, which is the spinal cord, and the meninges are protruding. Sometimes sacs are covered in skin, and others tissues and nerves are exposed. Now this is a meningeomyelocele. Okay, due to a lack of folic acid in the diet, recommendation for women of childbearing age is 0.4 milligrams folic acid daily. Hydrocephalus. This is a buildup of cerebrospinal fluid in the ventricular system. Increased pressure in the brain that can lead to brain damage. Okay. There are two types. or two basic causes. They have obstructive, where the flow of cerebrospinal fluid within the ventricles is blocked, or the communicating of the flow of CSF within the subarachnoid space is impaired. Okay, so that's with the ventricles, and remember the spinal fluid is manufactured in these ventricles. Okay, so as the ventricles enlarge, so will the head. And here's a picture of a little baby with hydrocephalus. And then we have anencephaly. This is the most severe form of a neural tube defect. It's failure of the cephalic aspect of the neural tube to close, and the cephalic is the head end, and this results in the absence of major portions of the brain, scalp, and skull. There's no cranial vault and little cerebral tissue. The neural tube is a narrow channel that folds and closes between the third and fourth week of pregnancy to form the brain and spinal cord in the embryo. Infants born with this disorder have no forebrain, which is the front of the brain, nor cerebrum, which controls the thinking and the coordinating part of the brain. So that's not good. Okay, now we're going to talk about congenital cardiac defects. Now we're going to talk about acyanotic and cyanotic defects. So in acyanotic, they don't turn blue, right? Oxygenated blood does not mix with deoxygenated blood. So the ventral septal defect, patent ductus arteriosus, coarctation of the aorta, and atrial septal defect. The greatest concern with acyanotic defects is congestive heart failure, okay? Because it's putting too much pressure on the lungs. It's putting too much blood into the lungs. The cyanotic defects, of course, they have cyanosis, and the arterial blood is not fully oxygenated. So you'll see that in tetralogy of Fallot and transposition of the great arteries. Now, the greatest concern with cyanotic defects is hypoxia. They're not getting the oxygen that they need. Okay, the ventral septal defect, or the VSD. This is an acyanotic defect. It's an abnormal opening between the right and left ventricles. Okay, you see how this blood is mixing? See, this should not be here. This should be closed. There should be a septum right here. Blood is shunted from the left to the right side of the heart. So it goes from the left and it mixes with the right. Okay. Allows oxygen-poor blood in the right ventricle to pass through and mix with the oxygen-rich blood in the left ventricle. The poorly oxygenated blood is then pumped out of the left ventricle to the rest of the body. A PDA, or a patent ductus arteriosus. This is an acyanotic defect. The ductus fails to functionally close. It's a persistent connection between the aorta and the pulmonary artery, and it allows too much blood to pass through the baby's lungs, can cause congestive heart failure. Now, this ductus arteriosus is normally present before birth. In most babies, the vessel closes within a few hours to days after birth. Now the ductus arteriosus, again, this is before birth. It allows blood to flow through the baby's body without passing through the lungs. The baby gets oxygen and nutrients from mom through the placenta and umbilical cord before birth. So the baby is not breathing on its own at this point. Okay. Now, this is closing of this PDA. I thought this was really cool. This is a little coil, and the coil, both are done with cardiac caths, and the coil is inserted during the cardiac cath into this PDA. Okay, and then for a larger PDA, this is they call it a PDA occlusion device. Okay, but it closes that up. So that was really interesting. Coarctation of the aorta. This is an acyanotic defect. There's a narrowing of the aorta, usually occurring in the segment just after the aortic arch. So there's your aortic arch, and there's your coarctation or narrowing. Narrowing of the aorta reduces the supply of blood to the lower part of the body. Surgical treatment consists of removal of the constricted region and end-to-end anastomosis of the aortic segments. Anastomosis just means to take two pieces and put it together. We have the atrial septal defect. Again, this is an acyanotic defect. This is an abnormal opening between the right and the left atria, which you see right here by that yellow arrow. It allows oxygen-rich blood to pass from the left atrium through the opening in the septum and then mix with oxygen-poor blood in the right atrium. Can cause lung problems if not repaired. There's a larger than normal volume of blood must be handled by the right side of the heart. Extra blood passes through the lungs, causing increased pressure in the blood vessels of the lungs. Tetralogy of Fallot. This is a cyanotic defect. Blue baby syndrome. There are 4 congenital defects. Okay, there's a ventricular septal defect right there. Pulmonary obstruction. This is where the pulmonary artery stenosis, including pulmonary valve. Okay, and there's the pulmonary artery right here, and there's a little stenosis, the narrowing. The displacement of the aorta. Where's the aorta? Right here. Okay, it's over the VSD, and it shifts to the right. So the aorta normally would be over here, right around here. Well, not over the mitral valve, but over here. But it shifts over the VSD. Okay, and then you have right ventricular hypertrophy, and it's caused by a narrowing at the entrance to pulmonary artery. So the right ventricle has to work harder. Okay. Results in insufficiently oxygenated blood pumped to the body, and these children have hypoxemic spells, and they call them TET spells, T-E-T. So I guess from Tetralogy of Fallot. And the last one we're going to talk about in this little video is the transposition of the great arteries. This is a cyanotic defect. The aorta and pulmonary arteries are reversed. The aorta originates from the right ventricle instead of the left, and the pulmonary artery originates from the left ventricle instead of the right. The aorta receives oxygen-poor blood from the right ventricle and sends it to the body without receiving more oxygen. The pulmonary artery receives oxygen-rich blood from the left ventricle and carries it back to the lungs. Pregnant mothers with uncontrolled diabetes are at higher risk of having children with this defect. Okay, so we're going to stop here and then pick up on the next one.